Hello everyone, you are watching sqadia.com and I am Dr. Hammad Haider. Today, our topic is thoracolumbar spine injuries. We will have three sections. In the first section, we will be discussing the pathogenesis and mechanism of thoracolumbar spine injuries, what to look for on the examination, especially with associated polytrauma patient, and usually with thoracolumbar spine injuries, there is always associated thoracic and abdominal injuries as well, and how to examine a patient as per ATLS protocols. Then we'll briefly going through what are the imaging, what type of x-rays we need to do, what is the role of CT and MRI, and then once we have diagnosed what type of injury it is, then what is the treatment of thoracolumbar spine injuries. In the next section, we'll be going through the major and minor injuries, which involves mainly the fracture, minor fracture of thoracolumbar spine, which usually involves the transverse processes or spinous processes, and the major fracture, which involve the posterior ligamentous complex disruption, which is an unstable injury associated with some kind of a neurological compromise as well. They will briefly going through its management as well as how to assess the major fractures of thoracolumbar spine. In the third section, we'll be briefly going through the neurological injuries, what type of injuries which can occur, especially whether there is complete spinal cord injury or not, how to manage that if there is complete spinal cord injury, especially associated with cervical as well as thoracolumbar spine injuries, and if there is partial spinal cord injury, how to assess what type of partial spinal cord injury it is. Is it central cord, is it anterior cord, or is it simply a posterior cord or a Brown-Séquard cord syndrome? And we will briefly discussing the management of these traumatic paraplegias and quadriplegias as well. Thank you very much. Keep watching sqadia.com.